Hi, everybody. I'm going to go ahead and get started. Welcome to our talk today on surviving the virtual curriculum, how to adapt simulation and gamification to your virtual classroom. I'm Sarah Scott. I'm an assistant professor at the University of Texas at Dell Medical School in Austin, Texas, and I'm also the clerkship director for our required 4-week EM clerkship. I'm going to be talking with you today with Dr. Tracy Thureen, and I'll let her introduce herself.
Hey, good afternoon. I'm Tracy Thureen. I'm an associate professor and the director of emergency medicine simulation at Duke University in Durham, North Carolina.
For over 2 decades now, educators in emergency medicine have been routinely incorporating simulation and gamification into student and resident education. As such, there are countless articles which espouse the benefits of using these interactive learning tools. We are, however, not going to be focusing on the pros and cons to using simulation and gamification today, although Tracy and I strongly believe that it's an important tool in your curriculum for adult learners. Instead, what we're going to focus on today is how we had to adapt our simulation and gamification to account for the COVID-19 pandemic when we could no longer be in the same physical space as our learners. So our learning objectives for this talk is to create a virtual escape room, to integrate simulation education into a virtual classroom, and to discuss the pros and cons of virtual education, specifically virtual gamification and simulation. Throughout this talk, you might think that Tracy and I make money from Google or Zoom, but unfortunately, we have no financial disclosures. So we use Google and Zoom primarily because 1, we have institutional access to Zoom, and 2, we're just very comfortable using the Google Suite. But really, you could use any video conferencing application and any SlideShare application that you choose to accomplish the goals we're going to go over in this talk. A little disclaimer here, neither Tracy nor myself would consider ourselves to be tech experts. In fact, I would say prior to the pandemic, I can count on one hand the number of times that I used a video conferencing application. So I think we probably can all identify with this poor man who is stuck with an unwanted filter over Zoom.
Mr. Ponton, I believe you have a filter turned on in the video settings. You might want to
can you hear me, Judge?
I can hear you. I think it's a filter.
It is, and I don't know how to remove it. I've got my assistant here. She's trying to, but I'm prepared to go forward with it. I'm here live. I'm not a cat.
I can see that. I think if you click the up arrow next to this.
Now, I don't know what's funnier about that video, the fact that the gentleman is stuck on a cat filter over Zoom, or the fact that his colleagues really aren't reacting at all. I feel like my colleagues would definitely be laughing hysterically at me if I was stuck in a cat filter, but maybe that says something about my colleagues, I don't know. At any rate, Tracy and I are not tech experts, but we are going to be talking about using Zoom and Google, and hopefully we can impart some knowledge from our use over the past 1 year. For the remainder of the first half of this talk, I'm going to provide a brief instructional overview on how to build a virtual escape room. This is a flow diagram that outlines the steps that we're going to go over in building our virtual escape room. We're going to go over each step with a little more depth. So the first step that you're going to take is you need a topic to teach. And this probably seems pretty routine. You probably do this for everything that you are currently teaching. For the purpose of this example, we're going to use a metabolic and endocrine review as our topic that we're going to teach. Next, we're going to determine our learning objectives. And again, this is something you're already doing for all of your educational endeavors. So we're not going to go over this in a step-by-step fashion. I also like to incorporate a theme when I'm teaching, and I'm a big fan of pop culture. So often my theme involves some type of pop culture reference. I'm a little bit behind the times, and I just finished Game of Thrones a couple months ago. So the theme for this escape room is going to be Game of Thrones. So after you have your topic to teach and you've developed your learning objectives with your theme, the next step is going to be to develop your puzzles. And these are going to be the challenges that your learner needs to solve in order to escape from your escape room. Except that you don't have a physical room that your learners need to escape because you're virtual. So your escape room is actually going to live in a Google form. Now, prior to last year, I may have used Google Forms to fill out a survey or take attendance, but I had never really utilized Google Forms maximally. And so we're just going to briefly go over how to utilize Google Forms, just in case there's anyone on here like me who didn't really know how to use this program before. And so that we're all on the same page when we try to do some more advanced things with Google Forms. I find Google Forms to be fairly utilitarian, but you can make it a little bit fancier by clicking on this little palette button, which is going to open some theme options for you. You can choose a background color, which I chose gray for this one, and a theme color, which I chose another gray. And then you can upload a header. And because I have the theme of Game of Thrones, my header is going to be the Game of Thrones title. I downloaded this from Google. Google Forms does have some preloaded images that you could use as well, or you can pull something off the internet. So you can make your form a little bit fancier. With your Google Forms, you can ask several different types of questions. You can ask short answer questions, long answer questions, multiple choice questions, which could be 2 choices, like a true false question, or you can provide like 8 or 10 choices for your learners to choose from. And you can ask questions on a linear scale. For the purpose of this talk, we're going to primarily focus on short answer and multiple choice questions, because I think they're the easiest questions for developing the escape room. The next thing you need to know, just for the basics, is how to add a question to a section and how to form a new section. So if you want to add a question to your section, you're going to click on the Add Question little plus sign along the right-hand corner. Then you can type your question in. Google Form will actually sense if this is a multiple choice or a short answer question. And then you can add images to your question. So I'm going to choose an image of the Game of Thrones cast, since we're asking what your favorite Game of Thrones character is. Now, we're going to tell the learners that it's required that they answer this question by toggling that button to the right. And then if I decide I want this question to actually be the first question, you can just drag and drop your questions to rearrange the order on Google Forms. You can also add a section by clicking on the 2 parallel rectangles. And then in this section, you could include more questions. So you're going to do that just by hitting the little positive sign along the right hand to add another question. And then you could type your question in there. You can also rearrange your sections like you rearrange your questions by just moving your section and selecting where you want your section to go. For the escape room, I find it useful to divide my questions up into sections to allow the learners to move through the form a little bit more easily. If all of your questions are in one section, that means the learners have to answer all of those questions correctly in series in order to escape from your escape room. And they may not know which question they got wrong, which might make that a very difficult endeavor. So you could break 30 questions into 8 sections, each with 3 to 4 questions. And then it's a little bit easier for your learners to identify where they might have a wrong answer and are not being able to get out of the escape room. So those are the basics of Google Forms. Now we're going to look at how we turn the form into an escape room. So let's start by looking at a multiple choice question. The first thing we want to do is we want to make sure that this required button is toggled to the right. And this is going to mean that our learners must answer this question in order to continue to move forward in the form. The next thing we want to do is expand on this menu to the right here with the 3 vertical dots. When we click on that menu, we want to make sure we have go to section based on answer checked off. That is going to give me some drop-down menus for each of my answers. That way I can tell the form that when the right answer is selected, the learner can move ahead. And if they select the wrong answer, they will stay in this section. So for this particular question of a 60-year-old with confusion and an elevated calcium, which is the least appropriate therapy, the least appropriate therapy is vitamin D. So that's the correct answer. And if they get that correct, they can continue to the next section. However, if they don't answer correctly, then they're going to go to section 7, which is actually the current section that they're in. So they'll be stuck in this section until they choose the right answer. Short answer questions are similar. You're going to want to make sure that you select that the question is required. So toggle that button to the right. And then you're going to expand on this menu under the 3 vertical dots, and you're going to choose response validation. When you choose response validation, it's going to give you some drop-down menus here. And the first drop-down menu is going to ask what format the answer should be in. You can choose text or numbers. And for this example, the major intracellular cation, we want it to be a text answer. And we want the text to contain the word potassium. Now, Google Forms is very exact. It has to contain the word spelled this way. So if your learners say K+, it's not going to accept that as an answer. This is important because if you're asking about a drug or therapy, you're going to need to let your learners know what format you want their answer. So you might need to say, I need a generic drug name. Also, it's case sensitive. So you've noticed that I put all lowercase here as a hint to write the word in all lowercase. You also have the option to write some text that the learners will see if they get the answer wrong. So for the short answer questions, they'll get some text if they get the answer wrong. And for this one, I've put, uh-oh, are you just guessing? We're going to look at another example and show how sometimes you could actually use that text to embed a clue or a hint to help your learner to progress forward on the form. Just like in the multiple choice questions, you also need to tell Google Forms where to go once your learners get the correct answer. So once the answer is correct, we're going to allow our learners to continue to the next section. Now, so far, we've just looked at simple multiple choice and short answer questions, but how can we make this a little bit more interactive? One way we could do that is to actually link to slides which hold clues to specific cases, and the learners will have to go to those slides and pull the clues off of the slides in order to answer the question that you're asking. So here I've placed a link in the Google form that's going to take the learner to an interactive slide. You can get as fancy as you want with these slides. Google would allow you to take a picture of your own trauma bay and upload it as the background to your slides. You could actually have your own trauma bay there as the background to your slide. And then you can embed links in your slide, which give your learners clues. So for this slide, if you click on the patient monitor, you're going to get patient vital signs. If you click on the patient, you're going to get information about the patient, like history of present illness and physical exam findings. You could even put JPEG images in here that show a physical exam finding, such as a rash. And then if you click on your computer monitors, you're going to get patient lab data, EKGs, or imaging. One thing to note when you're sharing links on Google is that you have to make sure you have your share settings set appropriately so that your learners can see your links. The default for Google is a restricted share. So every time you're going to share a link, you want to make sure that you activate the share button and have anyone with the link selected so that anyone that clicks on that link will be able to view the link. And then you want to make sure you also have view selected here instead of editor, because you really don't want your learners editing your stimuli. After that, you can copy the link and you can put it into your Google Forms, or you can link into your Google Slides. Finally, as you're setting up these questions, you want to make sure that you embed some type of hint or clue in case your learners get stuck. And this is particularly important with those short answer questions because they have to be very exact in their answers. The last thing you want is for your learners to be stuck on the second section of your form when there's 8 sections, because then they're not going to get through all of the learning objectives that you had intended. So for this particular question, the answer is isopropyl alcohol. However, if your learner were to put isopropanol as their answer, the form would actually not accept that, even though it's basically an equivalent answer. So as part of the hint, I've let the learners know that the answer contains 2 words. And I also let them know that there is no anion gap. That was a clue that they should have gotten from the labs on the slide, but in case they missed it, I have put it here to help them get through the form. You can really go down a rabbit hole with different types of technology and make your slides super interactive and fun. You could embed sound bites, GIFs with CT images or monitor screens, YouTube videos with physical exam findings. Really, the sky is the limit for creativity. And you definitely don't have to be pigeonholed into Google Slides, although I think it's easy to use and I'm already using Google Forms. So using another Google application is just fairly easy for me. There are other interactive slide platforms. This one is called ThingLink, and you can download pictures of your trauma bay or your resuscitation bay and then upload them as your background. In ThingLink, you can actually do 360-degree views of rooms. So you can actually have your learners have to like look around the room for clues. And then you can embed icons that hold links with information about the case. So here I've embedded an icon for patient information and an icon for the monitor. And then if you had lab or imaging data, you could embed an icon there to show lab or imaging data. All right, so we've developed our puzzles and our challenges, and we've incorporated our prompts and clues so the learners can get through the form. And now we want to decide exactly how we want our learners to move through this form. I personally like team competition, and I think it fits well with the theme of an escape room because you usually compete as a team. And so I typically will divide the learners up by PGY year, and we have 24 residents total, so that puts 8 learners max in each group, which is probably about the maximum number of learners that you would want in a breakout room on a virtual platform. If you have more residents, you're probably going to want to divide it up into more groups. You could also have your students or residents compete as individuals to see who can finish first, or you could just have it be a completion exercise, like you give everybody 45 minutes and you just want everyone to finish by 45 minutes. It's really up to you. Now we're finally ready to implement our escape room. But before we get started, we have to introduce this platform for learning to our learners because they are probably familiar with the technology of Google Slides and Google Forms, but they haven't ever used it in the way that you're intending them to use it. So when I do this, I usually will put my form in preview mode by hitting the little I, and then I'm going to share the Google form with the group with an example case. I let the group know that there are going to be links embedded in the form, which they will need to click on, and that they need to find some clues in these slides in order to solve the cases that they're going to be presented with. And I show them where they can get data on vital signs, data on patient past medical history and history of present illness, and data on EKGs and labs and imaging. Then I show them how they're going to close out of the tabs once they've looked at them and go back to the Google Forms to answer the question. Now, the answer to this question is Cersei Lannister, but just for the sake of example, we're going to choose the wrong answer so that they see that if they select the wrong answer, they actually don't move forward and they have to keep trying until they get the right answer. The next thing you need to do is actually get a link to share with your learners. The way you get your link from Google Forms is you just go to the send button. And once you've hit the send button, you want to highlight the link, and it's going to provide you with a link. And typically the link is very long. So I like to shorten the URL to make it less cumbersome. And then you're just going to copy that link. And then I'm going to take the link back to my video conferencing application and paste the link in the chat. I then ask my learners to take that link and copy it and paste it into their browser so that they have it when we go into our breakout rooms. I let them know that the best way to approach this is usually to have one person in the team share the Google form in the breakout room, and then they can each work off of that Google form and interact with the slides to solve the cases. I usually give them a time limit, like 45 minutes, and then we'll come back to the main room to debrief. All right, so this is what the form that we just designed is going to look like when we implement it as an escape room for our learners. So here the learners go, they're entering the escape room, and this case has a hyperlink to a slide. So they're going to go to the slide and they're going to look at the data, the clues that are in this slide about this patient. So they'll access the patient monitor data to get vital signs on the patient. And they can go to the patient to read about the history of present illness, past medical history, and any exam findings. And then they can look at the computer monitors to look at the labs, imaging, or EKGs that might be available. They're going to toggle back to the form. And just for the sake of example here, I'm going to put in the wrong answer so that you can see that the prompt is going to come up to give them a hint as to what the right answer could be. Once they have the right answer, they can move forward in the form. And then they're going to have to answer both of these questions correctly in series in order to move to the next section. For this section, our link actually is going to take us to that thing link that we created. And in the thing link, they can click on the icons to get more information about the patient. For this specific case, I actually have embedded a YouTube video with some exam findings consistent with hypocalcemia, so that the learners can take a look at what the exam actually is going to look like for this patient, as well as read through the history of present illness and the patient's past medical history. Within this slide, they also have patient monitor data that they can look at to get the patient vital signs. And then they'll toggle back to the question. And just for the sake of example, again, I put the wrong answer so you can see that they can't get out of this specific section until they answer correctly. And that's it. That's all the questions we created. So they've finished. So now I'm asking them to put in the group name and the time that they finished so we can see which group finishes first at the end of the escape room. So that's a really brief overview of creating a virtual escape room using Google Forms. And I will take any questions you might have at the end, but right now I'm going to hand things over to Tracy, who's going to talk about adapting simulation to a virtual classroom.
Great. Thank you so much, Sarah. That was amazing. So let's get started again with another brief how-to. So I think we're all very familiar with this scene. Pre-COVID, right? We had our learners, we had our mannequin, we were able to be in a room and maybe in our simulation center, interacting and communicating as we normally do. And then March 2020 hit. And we were all left with a lack of room space. We had no mannequins to use, and social distancing was a thing. So we had to be creative. We had to come up with something to do some simulation. So this ended up being my setup in my home office, and maybe some of you had something like this happen too. So let's talk about how do we even start? So first, it's with the basics, right? We really just need a few basic things to adapt our simulation to a virtual environment. We have to have a camera of some sort, either built into our computer or external. We have to have some kind of video conferencing platform, which, as Sarah mentioned, our institutions have been using Zoom, so we got familiar with that. And then we have to have some kind of cloud storage where these resources that you're using and saving and building into these platforms, you can keep. And that way, having that, you can share the resources with your learners and with other faculty. So I'd be remiss if I didn't share one resource that I used both for my in-person sim as well as virtual sim. So the QR code. I particularly found it helpful in in-person sim for actually a couple of things. So for one, you can make a QR code that corresponds to, you might have guessed it, a Google form that you can use for attendance or evaluation. So an in-person sim, using this and tacking it to the wall where you're doing your learning can be really helpful and easy for learners. And then you don't have to pass out a tree's worth of paper. And then when we're doing virtual sim, you can actually embed this into the slideshow that you're going to use. And then again, learners can use that to access Google Forms. Of course, you can do links as well, but it's just a handy way of doing it. So here we go with another flow diagram. How do we think about changing our simulation from what we had before or de novo and going forward to a virtual sim? So we start with developing slides for a case. And again, you might have guessed it, I chose to use Google Slides. Again, this is not something, like Sarah mentioned, that I had ever used really before COVID. I was very used to PowerPoint, and that wouldn't be a bad choice either. It was just, again, a nice way that if you had other educators working with you, that you could do these together. So what are you going to put on a slide to bring a virtual simulation to life? Well, you have some great opportunities. You have opportunities to find some images of great physical exam findings. You can put your labs that normally you might have passed out to learners on your slides. And you could even do some things like put in a sound bite. So even though we don't have a mannequin for our learners to listen to now, putting in a sound bite of heart or lung sounds might be helpful. So take an example here. It's a little wheezing. All right, and just to mention on this point too, for images, you really want to make sure you're doing high quality images when you're doing these. Websites such as Pixabay or Unsplash can be very high quality images to include, and you can also use something like Google Images. You just want to use the search feature on tools to find large images, so they're not pixelated when you put them on a slide. So the next part of our flow diagram comes to, do you have a virtual patient monitor? We all might know that having a functioning monitor for our learners really brings the case to life. So if you have one of these available that came with the software for your mannequins, you could go ahead and use that. So something like this might be a very familiar sight. This happens to be a picture of layer dolls that you might be familiar with, and you can use that as an application software to run during your virtual simulation. So what if you don't have that, or you don't have other facilitator to help run that? Well, you can use a screen-based tool. And for those of you who might be resource limited at times, there's one particular one I'm going to bring in now called the Virtual Recess Room. And I have to give kudos to a Canadian emerged doc, Dr. Sarah Bowie, who came up with this. It's a free open access resource that's on the web. The site is here, that uses, what do you think? Google Slides, and has a set of templated slides to be able to interact at the same time with your learners doing a simulation. So let's see what this might look like. This is a picture of one of the slides that you can pull right from the site, and we'll kind of talk through it. So you have a templated virtual recess room. As you can see, there's a patient in the center. Along the side, there's a portion where your learners can document notes and orders, the team roles that they are in. You can see that there's text boxes with visuals that you can move around on and off the patient. You might put on a pulse oximeter here or a bag valve mask. You also can see that along the side are monitors, numbers. You can change these as the instructor at the very same time as everyone's in. You can see even there's a text box with the running EKG that you can take in or out or sub in another rhythm, and text these as the students run through the case. So really nifty. The other slides contain medications that you can copy and paste onto this main recess room. So really great resource. Highly suggest checking that out. So next in our flow diagram, you want to assign your instructor roles. We all know that with simulation, you not only have the patient, but you may have a nursing role, you may have consultants, and you need to know kind of what your faculty arrangement is now. So if you don't have multiple faculty, I might suggest you use a combination of photos and Post-it notes. So we'll talk more about this in a moment. But we're using a Post-it note in a way, not as a reminder, but to cover your camera. And we'll talk about that a little bit more in the following slides. If you do have multiple faculty, then you may use virtual backgrounds. And maybe you've been used to that with your kids at home and covering up. So here's an example of kind of what I'm talking about, the two different types of virtual backgrounds you might bring on board. So on the left, you have a picture of a male paramedic. And on the right, you just have kind of this paramedic background if you have. So how do you even do this? You all might be quite familiar with this, but let's just take a look. So when you're on your Zoom, we're gonna go down and you'll pick the caret to choose your virtual background. You get to that, you're gonna go to your plus sign to add some more. That's going to give you the choice of adding an image or a video. In this case, we'll be adding images. And it's going to take us to our desktop, maybe. We're going to already have to have chosen and downloaded photos from online or our own photos on here. So I'm going to choose paramedic male and go ahead and open that up. And that's now going to be part of one of my series of virtual backgrounds. So what am I talking about? So if right here, if I have an image, I'm on camera, and here I brought up my virtual background of my male paramedic. If I want to, in a sense, become that paramedic, all I need to do while keeping my camera on is cover up my camera. And then here I am, I can talk through having the picture of the paramedic. So a little bit nifty, a little bit, medium tech, I would say. So Sarah mentioned it can be really fun to do themes during your virtual sessions, just kind of spice things up. I like Hollywood themes, movies, shows. So you could, why not choose Friends to be a consultant, one of them? Why not have Nurse Ratched be your nurse? It can make it more entertaining for your learners. So we're back to our algorithm. We've kind of gone through it and we're at the end. So what we really need to do with a virtual simulation setting is set expectations for our learners. So they knew what to do when they were in front of the mannequin, but now that they're just on another camera online, we need to set some expectations of what they're going to go through during their time with you. So flow diagram again. I like to explain how the learners are going to run through their simulated day. So in this case, we're going to start off by letting them know the timing. I tend to do a diagram like this along the bottom. So to let them know, in this case, when I was working with a group of medical students, I let them know they'd have a 75-minute session. We're going to go ahead and follow group 1 through their time period. So group 1 and group 2 are going to start off in a main room. They're going to spend 10 minutes doing an introduction to online and what's going to happen during their scenario. Then they're going to break off. Group 1 is going to spend 15 minutes doing a case, like we mentioned, with the slides available and a virtual patient monitor. The following 15 minutes, I put them into a breakout room, and I've already developed questions and some kind of visuals for them to go over for 15 minutes while they're waiting. And then that last 30 minutes, group 1 joins up with group 2 for a group debrief. And that way they know what's going to happen during their day. Also, very importantly, because unlike when we're together and actually can just turn to the side to your neighbor to figure out roles during the simulation, you really need to set that up ahead of time and tell your learners to do that. So the roles that are important in a virtual simulation is certainly a team leader or interviewer. Not everyone can talk to the patient at once. We all know those times where either someone's talking over one another, and it really doesn't work well when you have limited time. The second is you want someone who can take a look at those images and labs, and they can be the interpreter for those. You also want someone who can flip over to that virtual patient monitor. And we'll talk about that in a second. And then lastly, having a scribe. So the chat box function is definitely your friend in virtual simulation. Not only is it helpful for keeping track of what's going on for the learners, but it also can be a great tool for introverted learners to communicate. So here's an example of how your screen might look while teaching, and one thing that you want to orient your learners to. As you can see along the top, I do have pulled down the options. On the right-hand side here, you see the chat box. In this case, you had learners along with their nurse and their patient, and they're jotting down what's going on in this toxicology case. As you can see along the top, they have an area where they brought down the options, and you can see that there's two shared screens that come down, one called Mrs. Rose, who happens to be the patient, and the other one called Patient Monitor, and Patient Monitor is checked. So they're able to split back and forth between two shared screens. Going back to a couple of slides where we talked about the number of faculty available, when you have more than one faculty and or a technician available, you certainly can have two people share, one doing the patient monitor and one doing the slides for your patient. And that can be really fun, but requires orientation for your learners. Next is a screenshot of how it might look for your instructor. So you'll note on this case, the instructor is sharing the complete metabolic panel for the learners who show up in the middle of the screen. You can see on the left-hand side in Google Slides, you might pull up the presenter view. This can be super handy because rather than scrolling through all your slides, trying to find which number slide has the BMP versus the CMP, you can see your slides and pull those down on the left, and you can just pause share between them and then continue to share after that so that you have kind of a seamless transition with the things that you're trying to share from the case. As you can see, as the instructor, when you're showing this, you do need to pull up a floating chat on the side. So lastly, let's see how we pull it all together and what it might look like from the instructor point of view when we have learners here. So to set the scene, this was a toxicology case. We had a patient who you can see Betty White on here from the Golden Girls, who was playing Mrs. Smith. Our instructor on this day was a male, being Mrs. Smith, so you'll hear a male's voice. You do have Carla from Scrubs as our nurse. You can see pictured there, and then our learners. You can see the chat box is in action on the side, and the screen that's being shared is a picture of a pill box and pills that the patient, she wasn't sure what any of them were, but may have ingested that day. So let's take a listen.
Well, in the pharmacy, there's that arthritis medicine. Bought some of that and took some of that. Took that this morning. I'm here. I'm gonna go back to sleep.
You guys think we should just go ahead with some naloxone so we can put out oxy for them? Yeah, that's good.
All right. So what about debriefing? Right? We're all used to, we have a debrief after a session, right? We've got everyone around, we're able to sit on the same level, we can have some eye contact, we might even see some body language suggest people are uncomfortable. But it's a little bit different during virtual simulation. And I'll talk about some ways that I have tried to address that. So I do another slideshow that I bring up with my discussion. And this is a slide that I made that I start off with. And I kind of have those things pictured of things that we talk about in a typical debrief. So how did it go? Right? Which is a little different to do when you can't really sort of look around the room, right? So I oftentimes will ask someone to give a summary of the case, and I have those other questions and I let it sit in silence. And oftentimes our learners will start bringing up things. And this is oftentimes the slide that I'll spend the most time on. But depending on what you have in mind for your debrief, if there's any other learning objectives that need to come across or be reinforced, you can bring up things like this, even a video, in this case, bring up with students about JVP. That can be part of your discussion slides that you wouldn't otherwise necessarily bring up in a typical discussion by having a video on the side. And then lastly, as I talked about before, during that discussion and debrief, at the end, virtually, I'll bring up an evaluation. And that way I can either drop it in the chat with a link to my form or use a QR code. It's nice because the link at the top too, you can just drop in your chat box for your learners too, and they can pick it up that way if they don't have their phone and their computer next to them. But who are we kidding? They usually do. So That's also just another tool. So we talked about all the good things that have come about for virtual teaching with the technology that's available to us, but there's still some limitations worth mentioning. So the first one is interactivity. I mentioned before, the nature of our contact on screen definitely makes us lose a sense of body language and the eye cues, eye contact cues that we typically use in communication. And this can make teamwork skills as well as communication evaluation more difficult to teach and to reinforce. So it's something to be thoughtful of. We also can struggle with learner engagement, secondary to the fact that you can turn cameras on and off, or there may be things going on in the background that can distract your learners or instructors. And I think that's when it's really important, back to that setting expectations for the environment that can help. The second issue that we come across for limitations is technical challenges. So there's many that come about, and I'm sure many of you have seen this in action. Certainly, internet speeds or availability can affect a planned education day. We also can have cameras such as microphones or cameras that malfunction, and that can make your session less than optimal. And also our learners or instructors may be technically challenged. They may not have had as much experience teaching or learning virtually, and making sure that your learners and instructors have a clear pathway for assistance during learning can make the difference between a successful session and a very frustrating session for your learners. And then lastly, it's important to remember that these creative endeavors can be time consuming to create. And it may be a while before the wheel doesn't have to be invented to be able to come up with content for these types of educational endeavors. So do we have a future with virtual platforms? You know, obviously this was a forced issue with COVID-19 in this past year, but even when the pandemic ends, there still may be advantages to using a virtual platform to supplement your in-person education. So for example, illness or quarantine learners. And we already know that this is a thing, and this would be a great option for us to continue. Certainly inclement weather, depending on where you live in the country. If you have a large snowstorm and it makes it unsafe to drive in, or you have a delayed opening, then teaching still can be done virtually. If there's a lack of physical space or restrictions on your physical space and your simulation space or conference room availability, then you can still hold workshops virtually. And if your learners or instructors are scattered in different places in your area or around the world, you can still teach using a virtual platform, which is really handy. So in conclusion, we had a really challenging year, as many of you did, but it proved to be really enlightening for both Sarah and myself. It sparked us to learn new things and incorporate material into formats that we may have never imagined if COVID-19 didn't hit. So despite some limitations that I mentioned, we think that these virtual platforms are worthwhile educational endeavors and are here to stay. The sky's the limit for creativity, and there are so many cool tools available to us. We hope that we help to stir up some creative juices for you all as well. And thank you so much for listening to our talk. We're happy to answer any questions or certainly get in touch with us if we can provide any further information.
Ladies, thanks a lot for that talk. I was just wondering, how did the students respond to these virtual options, both kind of in the setting of just a whole virtual curriculum in general, but also compared to, you know, what they had experienced in the past as far as in-person events?
I can answer for the escape room. I think the learners really enjoyed the interactivity and kind of the challenge, the competition as a team, actually, for the virtual escape room. And I can see you bringing that to in-person escape rooms, which, you know, they have used for medical education. So I think it was enjoyed for the virtual escape room.
Yeah, I'll say, I had a mixed bag because I think simulation in general, so many people love the mannequins. They love the mannequins. So when you don't have that available, you really do have to step up your game with incorporating. I think using the virtual patient monitors can be really great. I think you have to be careful on a virtual simulation platform for information overload, depending on the level of your learners and the pace of the information, because not only are they looking on one or two screens, but things can be dropped in the chat, and depending on how their computers can actually bring up, downloaded things, it can get a little overwhelming. And I think that's something to be thoughtful of with virtual simulation. But in general, especially if you can up your game with your actors, it can be really enjoyable for learners and instructors.
Let me just say, for the rest of the audience, if you want to add any questions to the chat, you certainly can. One other question I had for you both was, it seems like these are pretty time-intensive things to create. I'm wondering how much of this was content you already had that you adapted, and how much of this was really, whole new curricular content that you were developing?
So I will say for the escape rooms, it was content that I had in more traditional lecture format that I adapted. And the first time I created an escape room, it took a very long time because I was not familiar with Google Forms. And so just like the ins and outs of creating the different sections took me hours upon hours. The second time it was much quicker and I already had the content, but it still was a little bit of a time suck. I also did a virtual simulation curriculum for my students, and that was a little bit quicker for me to adapt, actually. I don't know about you, Tracy.
Yeah, I adapted my existing curriculum to it. I will say that there was just the learning, I think, process of learning how to use Zoom even in different ways like this, doing the shared screens and duplicate share screens, virtual backgrounds, I think a lot more on the Zoom and the web platform for that was more of a learning curve than, like Sarah said, with something like Google Forms. But doing more interactive things like sound bites and videos and looking over the web in places I had never really investigated before. So I think, like she said, it gets easier each time doing these things because you're more familiar with the resources out there.
Well, thank you both. That presentation was really creative, and I know I learned a lot of things from it. So really appreciate that, and thank you, audience, for being here, and hope you enjoy the rest of the conference. Thanks.